Okay, welcome to our program today. I've been asked to speak um, on some topics related to public health and the coronavirus. I'm Dr. Shad Fani Marvasti, Associate Professor of Family, Community, and Preventive Medicine at the University of Arizona College of Medicine, Phoenix. And my area of expertise is in public health prevention, nutrition, and health promotion. So today we're going to talk a little bit about some of the questions that have come across to me regarding public health and some of the changes that are happening with this COVID-19 reality. One of the questions is this idea of public health being a two-way street, and what does that mean in terms of individual responsibility for my own health as well as my social responsibility to others. So I think the basics of what we know, this is a virus, and it can be spread through all the channels that usually most viruses are spread. We're most familiar with the cold virus as well as the flu virus. Usually with the flu virus, we have vaccination programs. With the cold, it's pretty self-limited. There are no real vaccines. This is coronavirus. It's actually a type of coronavirus. So that's a technical name for it is COVID-19. Coronaviruses in general have been around for quite a long time, and they're really the normal cold viruses that we get. But the problem with this, as everybody knows, is there's so many unanswered questions about how much of an impact this can make on our health, the fatality rate, the mortality rate, as well as the virulence. It appears to be highly infectious. And so you've had these mass lockdown efforts all around the world. The question now is, as we're coming out of lockdown and in the US as well as in other countries, we're trying to learn how this will work and what does this look like. So when you talk about the two-way street of public health, there's the individual responsibility. If you want to protect yourself, you want to protect your family. And so this whole process of social distancing was put into place. And by far, that's still the best thing we can all do. Even if you look around the world at reopenings, the UK recently has talked about reopening. They changed from stay home to stay alert. And in fact, trying to stay home as much as possible. Really, the best thing you can do to protect yourself is reduce exposure to the virus for as long as possible. If you are going to go out, you obviously want to minimize your contact with others. If you are, do it 6 feet apart. Obviously, grocery shopping puts us at risk. Wearing a mask is, I believe, part of the second side of this two-sided street in terms of protecting others that we come into contact with. Really wearing a mask is really the socially responsible thing to do from a public health perspective, because it prevents us from sharing the infection with others. Now, the thing about this infection, which is really a challenge, is that most of us who have it won't know that we have it. It's asymptomatic, right? And the period of time of being asymptomatic is about 14 days. So, and we've seen that you can actually still spread it. So the viral load and the ability for you to infect others remains high, even if you don't have any symptoms. And there's a percentage of people, and we don't know what the exact percentage is, because we haven't done enough testing and tracing, contact tracing, of people out there that basically will have the virus and will be sharing it, infecting others without knowing it. So that's where the social responsibility of wearing a mask comes in. So I think as we're opening up, it doesn't mean that we suddenly have a green light to go out and resume business as usual. We still have to maintain social distance. And in fact, if you don't need to go out, if it's not absolutely necessary for you, and if there are some things that you don't need to do and that are more luxuries, probably I would reconsider whether to do this. Now, another thing is if you're one of the part of the population that's older, we're seeing poorer health outcomes in terms of people who are hospitalized being over 65, in some places even over 55. And then whatever age you are, if you have any kind of chronic disease or chronic medical condition like diabetes, heart disease, high blood pressure, I would consult with your doctor and really consider whether or not you would expose yourself unnecessarily. I've been asked about boosting your mental and physical health during this time. I think next time we're going to talk more specifically about what you can do to boost immunity through your food and lifestyle. In terms of your mental health, using novel telemedicine video profile video platforms like Zoom to connect with others, I think is now more important than ever. It's an opportunity to take time to connect with your loved ones. If you've never connected recently with certain friends you're thinking about, that's obviously very good for our mental health, as well as just taking time as possible, depending on where you are, to be outside and be exposed to nature, even though we have to be socially distant. For example, I've started incorporating a daily walk with my dad in the morning, because I think it's good for his mental health as well as for mine. And it's a nice time of day when where we are in the desert, it's not too hot, and so we're able to get out there and walk around. We see other people walking around too, and that's something that's really neat to do. So creating new habits is another thing I've been asked. This is, we're a few months out from the new year, and obviously 2020 has been quite a year so far because of the coronavirus, but many people have New Year's resolutions every year in terms of what they want to do to be healthy. They may say they want to start a certain diet, they want to sleep earlier, they want to reduce other unhealthy habits. Well, this is a time and opportunity to really do that because of the space that we have in terms of being more at home and having that ability to do it. And so I think that's another thing I would consider doing. We're seeing a lot of the disparities and challenges in our healthcare system exposed right now for the first time because of what's happened with the coronavirus. For example, we see that African Americans and Hispanics and members of other minority ethnic groups like Native Americans tend to be disproportionately affected with poorer outcomes, being sicker when they're infected with this. And I think that's a reflection of fundamental injustices in our healthcare system that we have acknowledged on the surface in the past, but now is being exposed at a higher level of visibility. And so we really have an opportunity right now to address these disparities in care that are really unbecoming of our system. We're seeing that at least in the US. And I think it's really a call to action to be able to address healthcare in these communities, much more time and money and resources invested to improve the health outcomes. Also with other vulnerable populations like the homeless population, the prison population, those are all places that we need to have a new lens in terms of looking at. Had a question about opening up restaurants, dining in some places they're opening up. I would say if you're a member of one of these groups that have a chronic medical condition, or if you're over the age of 65, I would think twice before going and dining in a restaurant. The air that's there from a public health perspective that's there, it's not going to be the safest in terms of exposure. And so I would say I would still advise doing takeout and carry out and not going into dine-in restaurants at this point, if at all possible. There's also discussion of workout in public gyms. I don't think that's necessarily the best idea at the moment. I don't think that's been widespread open yet. For those who do go and try to brave the restaurants, I would definitely keep your distance, minimize the time that you're there as much as possible, and hopefully all the staff there are wearing masks, and even you could even consider wearing a mask when you're not eating your food. Same thing with going to grocery stores. Obviously, that's another question we got. We've also had discussions about starting sporting events. I know some places in the world are thinking about starting sporting events with no spectators and just televising the events. That sounds like a good idea as long as they can protect the athletes. So I think these are some of the areas that will be explored in the coming weeks and months. So if you're in one of those areas where they're starting to open up and having partial reopening, we're not going to see the impact of that for another 2 to 3 weeks, because remember, the virus has a 14-day period of time before an infection can be visible, and it's like the delay period. So I think we're going to judge the success and the safety from a public health perspective of the openings that are happening right now, locally in Arizona as well as throughout the country and throughout the world, about 2 to 3 weeks after those openings happen. So when you have an easing of a restriction, look for 2 to 3 weeks after that to see what the impact is going to be. And then we may have to go backwards. One of the things I've said before, I'm going to say it again here, one of the reasons why we want to keep this from spreading and we want to limit our exposure, one, if you remember, one of those high risk groups, if you have chronic conditions, if you're older, you definitely want to be more mindful. And it obviously makes sense not to get exposed if at all possible, even as far out as when the vaccine is developed or until we have more therapies and treatments available. And also in general for anyone else. If I had a choice of being exposed and potentially being infected by it, I would choose between now and 6 months from now, I would choose 6 months from now. Because 6 months from now, we're going to have that much more knowledge in terms of how it works, how to treat it, and we'll be that much closer to a vaccine. And again, if everybody gets infected all at once, it overburdens the healthcare system. And thankfully, that hasn't happened everywhere except for some of the hotspots that we heard about in the news, some of the countries like Italy and some of the places like New York City in the US. But to prevent that from happening, we don't want to jump to back to business as usual. And so, from a public health perspective, I think what's going to also happen is you're going to see this next year with the flu, because every year in the winter, the flu comes back. And we're going to see a double challenge with the flu and with coronavirus in whatever state it's in, and how much of it's actually spread in the community. So, doing social distancing is something that's probably going to stay with us even after this acute crisis, because it is a way of preventing um, unnecessary spread of infection throughout the community. So, things like handshakes will be reevaluated. Um, things like even hugs and kisses on the cheek, which in some cultures we do, may also have to be reevaluated moving forward, and thinking about this stuff until we have a better understanding of this and a better understanding of boosting our immune system and the development of vaccines. So I'm going to pause there and look forward to seeing everybody for future sessions.